Hello, this is Dr. Calvin Chatlos. I'm an addiction and a child and adolescent psychiatrist practicing in the state of New Jersey. And I thought I'd take a minute or two just to comment on a recent article that was posted in the Psychiatric Times, a regular newsletter for the psychiatric profession and mental health. It was in the May issue called Deprescribing. Now, that may be backwards on your screen. Deprescribing Medications. Does the term belong in the psychiatric lexicon? Written by Dr. Joseph Goldberg, who's a professor at the Icahn School of Medicine in New York City. And in our culture, the term deprescribing has sort of been taken by many anti-psychiatry proponents to suggest not prescribing, not just not prescribing psychotropic medications for mental health disorders. Well, that's not what this article is about. This article is about deprescribing medications, really about good psychiatric practice, that it recommends there should be a regular, if not at least an annual, reevaluation of all the medications of all patients, looking at a combination of things. Are there side effects that may be better handled with either lower dosages or change in medications? Has the medication done its job? If the person had been in a psychosocial stressor situation, progressed to a biological depression or anxiety disorder, medications help to lower symptoms. They're sort of in remission. They're doing well. They have learned the psychological or social skills to manage their situation, or the situation itself may have even changed. Is it still needed? Is it time to consider tapering and lowering and possibly stopping the medications? Now, it also emphasizes that this should be done under psychiatric supervision. There may be various and significant withdrawal, discontinuation symptoms from a tapering or a stopping of medications that should be done under psychiatrist supervision, but it should be actively evaluated, assessed, and encouraged by the psychiatric profession. It also mentions polypharmacy. Does the patient really need to be on 2, 3, or 4 psychotropic medications to deal with what they have been diagnosed with? As well as, are there alternative approaches that may help to replace one of the medications? Have they been in therapy with CBT, DBT? Have they learned any of the skills to help manage the depressive or the anxiety symptoms that they no longer need the medication? It recommends that if there's a polypharmacy and a medication has not shown at least, if not more than, a 25% reduction of symptoms, was it really effective enough to continue the risk of possible side effects? The article emphasized this is really about true informed consent. What are the risks? What are the benefits of a long-term psychotropic medication maintenance? The upshot basically is that it presents a very concise approach for for the real professionalism in psychiatry, responsibly managing medications as only a part of a larger holistic practice, as well as, and I don't know how many patients or public people may see this video, but patients should ask their professional, their psychiatrist, for a review, for a consideration. Do they still need these medications? And actually carry on a dialogue. Any good psychiatrist should be willing to at least have a dialogue openly and discuss the pros and cons of stopping or continuing various medications. So I hope this brings to light and highlights that this was a great article, very relevant, and hope that it may be useful to whoever sees this video. Thank you.